This multivitamin and iron product is used to address vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and play a key role in maintaining good health. It is important to take this medication as directed by your healthcare provider to ensure you are receiving the proper dosage. It is typically recommended to take this medication with a meal to maximize absorption. When taking Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins, it's important to follow the directions provided by your doctor or on the product package. Typically, it's taken once daily on an empty stomach, either 1 hour before or 2 hours after meals, with a full glass of water unless otherwise directed by your doctor. If you experience stomach upset, you can take it with food, but avoid taking it with antacids, dairy products, tea, or coffee within 2 hours before or after the medication. It's also important to remain upright for at least 10 minutes after taking the capsules. If you're taking the delayed-release form or extended-release capsules, be sure to swallow them whole and not to crush or chew them. Taking the medication regularly at the same time each day will help you get the most benefit from it. If you have any questions about the best way to take this medication, be sure to consult your doctor or pharmacist for guidance. When taking Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins, you may experience temporary side effects such as constipation, diarrhea, or upset stomach. These effects should go away as your body gets used to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist. You may also notice that your stools turn black while taking this medication, which is a normal and not harmful effect of the iron in the capsules. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Serious side effects are rare, but if you experience symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects or have concerns, it's important to contact your doctor or pharmacist for further guidance. As for the best time to take this medication, it's recommended to follow the dosage instructions provided by your doctor or on the packaging. This may vary depending on your individual needs and health condition. It's important to keep in mind that accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. So, make sure to keep this product out of reach of children. In case of an overdose, seek medical help immediately or contact a poison control center. Before taking Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins, it's important to inform your doctor or pharmacist about any allergies you may have to its ingredients. This product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to tell your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests. It's important to inform your doctor about all the products you use before having surgery, and to inform your doctor if you are pregnant or breastfeeding before using this medication. It's important to note that this product can interact with other drugs, potentially affecting how they work and increasing the risk of serious side effects. It's a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of this product. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. This medication may also interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors know that you use this drug. If you or someone else has taken too much Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins, do not share it with others. It is important to keep all medical and lab appointments while taking this medication. Some brands of Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins may also contain ingredients such as docusate. If you have questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to remember that Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins is not a substitute for a proper diet. It is best to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. And it is recommended to take Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins as per your doctor's advice for optimal benefits. If you are taking Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. It is important to take this medication at the same time every day to get the most benefit. Make sure to store Wescap-Pn DHA 27 mg Iron-1 Mg-300 capsule multivitamins at room temperature, away from light and moisture. It's important to keep all medications out of the reach of children and pets, so store them in a safe place. When it's expired or no longer needed, make sure to properly discard this product. If you're not sure how to do that, consult your pharmacist or local waste disposal company for guidance. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.